Welcome back, ladies and gentlemen. Well, the President Abdel Fattah al-Sisi was keen to put an end to the waiting lists in the hospitals. The Ministry of Health announced that 1.7 million surgeries will be performed as part of the presidential initiative to end the waiting lists. Well, to shed more light on this, we have the pleasure to have this phone Dr. Awad Eddin, Presidential Health Advisor for Health and Disease Prevention Affairs. Good morning, sir.
Good morning.
Well, Dr. Eddin, can you talk to us about the importance of President Abdel Fattah al-Sisi's initiative to end the medical waiting lists in the hospital? Actually, that was really a very big problem that was facing the field of health and facing the citizens of Egypt.
Yes, it was a very good initiative. Because, as you know, there are some operations which is called operations, which may be the waiting list a long time, so that this initiative makes sort of resolution of this problem. And up to now, we have we are now reaching about 2 million of people received the surgical interventions for transplantation, tissue transplantation like liver transplantation or renal transplantation, and many cardiac operations, and also operations for cancer or any other diseases like orthopedic surgery or cerebral surgery. And also we have many patients, very cardiac patients received the intervention like coronary stents, etc. Yes. So that it is very good initiative which makes resolution for the problem of the patients and their families complaining from the chronic problems.
Yes. To what extent have or in what stage have this initiative reached until now and solved?
Still we have some patients, yes, because many patients, they have information about this initiative, so that although at the beginning of the initiative we have 12,000 patients, but now we are reaching more than 2 million received, and still we have some new cases admitted to this initiative, and we use all the facilities available either in the Ministry of Health or the university hospitals or the private sectors to give the patients the indicated surgical interventions.
Yes. So what are some of the types of treatments and services that is included in the initiative?
I told you we have some tissue transplantation, some orthopedic surgery like joint replacement or other surgeries, cardiac surgery, and cancer surgery, and many other diseases. All the diseases which require intervention, either surgical or medical, our interventions, other interventions, they receive the indicated medications or indicated surgery under the umbrella of this initiative.
Yes, Dr. Eddin, since President Abdel Fattah al-Sisi came to office, he was keen on gave very good care to the health of the Egyptian citizens, and that was very clear through several initiatives, among them, of course, what we are discussing today, which is ending the list of the waiting lists in hospitals, and also the initiatives of hepatitis C, other initiatives like the early detection of the breast cancer for the Egyptian women. These are initiatives that are going on and started years ago. So give us an idea about the outcome of these important initiatives.
Definitely, the outcome is very good because early detection of any problem, any medical problem, cancer or even 100 million detection of
Yes.
diseases is very effective because many patients were complaining from chronic diseases like hypertension, diabetes, rheumatic disorders, and many other diseases, so that you search for detection of any disease in the early stages. This definitely means very good prognosis, and the follow-up of the cases to receive the indicated medications makes the patient under control. So that if you detect early the hypertension, diabetes, or other diseases, you can prevent many patients to develop later on chronic renal failure and need dialysis or transplantation. So that the early, and now we have a very important initiative to detect any congenital disorders in the children, and we have an initiative for detection of any abnormality in the ear or the eyes, so that the early detection of disease, as you mentioned, is very important because you can prevent the progression of the disease and the complications which can be related to the underlying pathology.
Yes, Dr. Tajuddin, the initiatives, the health initiatives by President Abdel Fattah al-Sisi did not only involve or gather the Egyptian citizens. It also gathered citizens from other countries who are living in Egypt. As the President have said that Egypt is received around 9 million from several countries, especially Arab countries around us, are living in Egypt. So the health initiatives have also gathered the foreigners living in Egypt, and especially, for example, Syrians, Sudanese, people from Iraq and from Libya and other Arab countries around us. What does this show of
This is absolutely right.
Yes.
We have around 9 million living in Egypt from different countries, so that all the preventive measures and also any intervention or curative medications for people living in Egypt from different countries, they receive the indicated medications or indicated surgery. This is absolutely right. And as His Excellency the President mentioned, any people, any person living on the Egyptian land, he is treated completely like the Egyptians from different aspects, including the medical aspects.
Yes, this is of course something that makes us all feel proud of the President as, of course, treating the other nationalities here in Egypt as Egyptian citizens, and that was very clear when the medical or the health initiatives gathers other nationalities living in Egypt. Also, Dr. Tajuddin, the initiatives launched by President Abdel Fattah al-Sisi to depict the chronic disease for the young children at schools.
Yes, as I mentioned to you, children with congenital problems or any other problems, diabetes, for example, or anemia or overweight, they receive a checkup and specific recommended medications or changing the style of life of our children. It is definitely a priority for us to give our children the indicated preventive and curative measures.
Yes. Dr. Tajuddin, is there any precautionary measures or medical checks that Egypt is taking if any other nationalities are entering Egypt from the borders? What are the precautionary medical?
This is very important issue. A complete checkup to treatment of the patients and the treatment of any detected infectious problems, so that there is complete checkup for them and also we give the children the vaccine against poliomyelitis, and any patient detected he will already received the indicated medications.
Yes, so Dr. Tajuddin, what is the program of this year concerning the medical care that the state is providing to the Egyptian citizens?
It is a regular one. It's progressive, as you mentioned and I mentioned, progressive detection of any underlying problems, very cautious to detect any infectious disease or pandemic or endemic diseases, and continuation to give treatment to waiting lists, and also chronic regular check-up and detection of any underlying or associated diseases. We have now priority for the most common cancers in Egypt, including breast, colon, prostate, etc.
Doctor, I thank you very much for joining us over the phone. I really had the honor to have you with us, Dr. Awad Tajuddin, Presidential Health Advisor for Health and Disease Prevention Affairs. Thank you very much for joining us over the phone. And with this, my dear viewers, we come to the end of this episode of our program, The Breakfast Show.